Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV. Thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Beth Bowen Schrock, and she is the owner of Bowen Dental Studio in Fayetteville, Arkansas. And Dr. Beth is a dentist as well. And we're talking about dental health and what healthcare providers should know. So Dr. Bowen, thanks so much for being here.
Yeah, thanks for having me.
So could you explain the broader role dentists play in overall health?
Yeah, I think the way we look at it is that your teeth and your mouth are a specialty, just like your heart or your lungs or your bones are a specialty. So we just look at ourselves as the expert of your mouth. And so, as we all know, if one part of our body isn't working correctly, then our body as a whole can't be healthy. And so, we obviously need our teeth for everything we do, to eat, to speak, to be out with our friends and family. So the more comfortable we can make that, or the easier we can make it on people, it's going to allow them to have a healthier life.
And let's talk about some myths. So there are some common misconceptions that patients have about dental care, especially social media has really inflated that. What are some of those common misconceptions?
I think broadly speaking, just that dental care is always painful or it's always expensive. And your dental care, at times our teeth might hurt, but when you actually receive dental care, it should not be painful. So I know we've all heard those stories. And then I think the biggest things we see on social media currently, there's a lot of people going overseas to get dental work. And so maybe more what we would call aggressive preps, like removing a lot more tooth structure than is necessary, kind of makes people panic when we tell them then, like, hey, we need to do this thing to fix your tooth. They maybe think we're doing a little bit more than we have to. And the other big trend we see are things like mouth taping, or if you receive this type of orthodontic appliance, all your problems are going to be solved. And while those are some treatments we might recommend, as just like you wouldn't start an antibiotic without talking to your doctor first, you really need to have an exam to see if some of those alternative treatments would be beneficial for you and if they're safe for you.
And one myth we hear a lot is if my teeth don't hurt, they're healthy. Can you explain why that's just not true?
Yeah. So the way our teeth are designed is that we have a really hard outer layer to the tooth, which is our enamel. That in most people, that's what you see when you look in their mouth and when they smile. And it is a mineral substance that protects our tooth. And then we have what I like to call the insulation, but your dentin, which is it's why I call it insulation, because it acts as a buffer between that outside world and our environment and the pulp. And the pulp, which is the very, very center of your tooth, is where your nerve and your blood vessel are. So you kind of have to have deep destruction to actually get down to the nerve. By the time our teeth hurt, we're having a problem with the nerve, which means we've gone all the way to the center of the tooth. So in a lot of ways, it's great that our teeth don't hurt because we have to eat to live. But it does make people feel like, well, I don't have any problems because my teeth don't hurt. It's just the way that they are structured so that we can continue on with life, even if one of them maybe has a problem.
And a common belief that sugar is the only culprit for cavities. What else should patients be aware of? Is that's not the truth?
That is not the truth. So the reason sugar's bad for our teeth is that the bacteria in our mouth eat the sugar and then they produce acid. So if we have a highly acidic diet, or some people just have a highly acidic digestive tract, then our teeth will still break down even in the absence of candy or sugar. So one of the biggest things we see is that patients aren't aware that when they do consume a lot of Gatorade or energy drinks or lemonade, things that are inherently acidic because they're citrusy, or maybe you grow homegrown tomatoes and you eat tomatoes all summer long. Anytime we're dousing our teeth in acid, even if it's a food and even if otherwise it's okay, that still will break down our teeth.
And many primary care providers interact with patients more frequently than dentists. What are key things that PCPs should know about oral health that could help them in patient discussions?
I think the biggest thing that a primary care doctor could help the patient with is to understand that even though maybe your insurance doesn't list it this way, your teeth and your gums are part of your body. So if we have a problem in our mouth, that is going to affect our overall health. And I also think something that's really important for our primary care doctors is that there's a lot of shame surrounding teeth. Maybe you don't like the way your smile looks, and it's a very outward representation of kind of who we are as people and what our health is. It's on display for everyone. So, we just always want to remind patients that you haven't failed in any way. We're just trying to help make you healthy, because shame really isn't a great motivator, and people already are super, super uncomfortable with coming to the dentist or feeling like they've done something wrong because they have a cavity or they're missing a tooth. And so I think that's where, as a primary care doctor, we can just encourage the patients, hey, this is to make you healthy. And a lot of people have tooth troubles. A lot of people have high blood pressure problems, and we don't think of them any certain way. It's just one more thing we need to do to make sure we can live a healthy life.
And are there warning signs that PCP should watch for that might indicate more serious dental or oral health issues?
Kind of a good glance around someone's mouth, if there are any visible holes, a lot of dark staining, the gums look really what we would call erythematous, like puffy and angry looking. Those are kind of indications that maybe the person needs to be seen because there could be something deeper going on.
And how important is collaboration between, say, a primary care provider and a dentist for patient health? Is that something that should be collaborative?
Yeah, I think so. Often we are kind of working within the maybe limitations or guidelines of a different organization, like the American Heart Association, or like our orthopedic surgery friends. And so we do always want to have that physician, who's maybe performed a surgery, or, maybe we've put a patient on blood thinners, but we need to do something that's invasive, like remove a tooth, that we can have open communication so that we are not unilaterally deciding something that would jeopardize another area of the patient's health.
And are there specific questions that PCPs can ask patients to better assess oral health without necessarily performing a dental exam themselves?
Yeah, I think just something as basic as, do you have trouble chewing your food? Mm-hmm. Or do you have pain when you eat? Or, is there anything that's keeping you from chewing the way that you want to? Things like that would be just a really good indication that, a lot of times people are hesitant to say, or maybe there's not an opportunity in just a general physical exam to say, hey, doc, I can't drink my coffee anymore because my teeth hurt. So a lot of times that can prompt patients to remember or think about their teeth if we ask how their chewing is going or how their eating is going, because people that are having an issue tend to self-select out of those things that make them hurt.
And are there particular populations? Is it an older adult, children, patients even with chronic illnesses where healthcare providers should pay extra attention to oral health?
Yes, I think the first group that comes to mind are elderly patients, particularly those that are in like a managed care setting, because, as we age, maybe we have cognitive decline, or maybe we're having trouble communicating. Our perception of pain is different as we age. And so we always want to check in a little bit more with our elderly patients because they may not be aware that there's a problem, or even as dexterity decreases, it's much more difficult to take care of our teeth. And then our diabetic patients, we worry about a lot because when our blood sugar and our A1C are not where we want them to be and are not well managed, we see acceleration of bone loss and periodontal disease. So our diabetic patients really have to stay on top of their gum and bone health if they want to keep their teeth throughout their life.
And where can healthcare providers and patients go for reliable information about oral health if they're preparing to go to the dentist, or maybe they just want to find out more?
So I think the best resource is ada.org. That's the American Dental Association. Of course, these days we can Google anything, but you'll definitely get scientific information if you go to the ADA website, and they have a list of common questions for patients. If you're curious about something, if you were thinking about a particular procedure, like maybe you need a root canal, then you can look at the American Association of Endodontists. That's a root canal specialist who's going to have the most up-to-date information and kind of just a step-by-step. This is what a root canal is, or this is how we do it. But always good to look for those associations because they're only going to put out scientific information. We're going to lose all of the myths that we've talked about.
And finally, is there one thing you'd like our viewers, especially fellow healthcare professionals, to remember about the connection between dental care and overall health?
Yeah, I think we're all familiar with the research over the years that, these certain patient populations that we've talked about, a lot of the bacteria that causes dental concerns is linked to heart disease, premature birth, Alzheimer's. And so we really don't like to see patients live with a chronic low-grade infection. And I think we wouldn't tolerate that in any other part of our body. And so sometimes reframing for the patient and saying, hey, if you had that sore on your arm and it bled for years and years and years, we would recognize that as an issue because we don't want that infection in our body. And so coming back and reminding people that our mouth is important, it's attached to the rest of our body. And then really specifically, these bacteria do cause some really serious problems in other areas, in our heart, in our brain, with our developing babies.
Well, thank you so much for sharing the supported information. It's so insightful and so important for our audience to hear. Thank you.
Yeah, thank you.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.